we will discuss physiological variation in blood glucose level. Blood glucose level is not very tightly regulated. It means the calcium level, for example, is very tightly regulated. It means even the slight change in calcium levels is very harmful for the body. Still, there is some physiological variation, and that is not undesirable. That is considered normal. And we will also see what factors determine that variation, or in other words, what factors cause that variation. Glucose homeostasis. Discuss it as one single interrelated topic. Hormones, how they cooperate with each other in the regulation. We will name different hormones, and we will homeostasis. The details of their mechanisms we will discuss in separate class. Mechanism. You will hear the sound of notification, and I have not admit you. It is just sound for request for admission. It may distract you, but bear with it. To begin with, let's think about some questions, basic questions, and then it will create interest in the following session. What are the dangers of hyperglycemia? You can speak or write in the message section. What happens if there is increase in blood glucose level beyond the normal one? Okay, osmotic diuresis. In more details you study in pathology. Diabetes, that is one disorder of chronic increase, persistent increase in blood glucose level. Type 1 diabetes, one of the important medical emergency as a complication of type 1 diabetes mellitus. Polyuria, okay, got osmotic. And then you have one case of diabetes mellitus in PBL learning, and that begins with impaired wound healing, increased thirst. Okay, again excess thirst, but non-ketotic hyperosmolar state. Okay, mainly type 2 diabetes mellitus. Spelling is Z there, I think. Polyphagia. Okay, polyphagia means here this graph shows two curves. For now, ignore the upper one that is related to diabetes. For now, just ignore it and see the lower one, red curve. And in the horizontal axis, there is time in hours, and in the vertical axis, there is 100 ml. Remember it, 100 ml. Simple but important. Deciliter means 100 ml, milliliters. Okay, then it shows the relationship between time and blood glucose level after meal. And to standardize it more, there is one test called glucose tolerance test. And it means we give one standardized dose of oral glucose and then measure the level of blood glucose. Generally, we give 1 gram per kg, 75 gram on average generally. Then what will be the response? After 1 hour, you see, let's see the initial basal level. Here it is about 90, slightly above 90, we can say 90. Okay. Before that test, there is the blood glucose level is 90. Okay, we can say it fasting level. Yes. Now, the effect of intake of glucose is the glucose will go into the intestine, and from there it will be absorbed. Now it comes into blood, and then blood glucose level begins to rise. And within 1 hour, you see the peak even before 1 hour, and then it falls. It does not cross here. You can see it is about 130 here, and obviously it is not above 140. And that is very, very important. Remember, this is the basis of the oral glucose tolerance test that is used in diagnosis of diabetes mellitus. Normal variation is normally not above 140. It is below 140. It may not reach 140, but it does not. Normally it does not cross 140. Then it again comes back to the basal line, may decrease slightly after 2-3 hours, And the main thing here is after 2 hours, at least after 2 hours, it should come to almost the basal line. And for diagnosis, the cutoff is even higher. You know, after glucose tolerance test, the cutoff for diabetes, you can see here above 200. And you can see it is a very far deviation from the normal one. The figure here mainly tries to show the normal variation in blood glucose. To say in other words, glucose level is not always constant. Even in normal cases, it varies. And the most important variation is caused by intake of meal. And see the variation. Basal fasting level for between meals, before meals, it is around 90. There is some range. It is around 90, you can see. It is not above 110 normally. It is below 110, maybe between 70 to 110. But mostly it is between 80 and 90. And remember the unit, milligram per deciliter. If you like to convert it into millimoles per liter, divide it by 18, because molecular weight of glucose is 180. Okay. Now, baseline, before meal, it is around 90. After meal, it is around 130, but does not cross 140. And again, within 2 hours, it comes back to at about 2 hours, it almost nearly to the pre-meal value. This is the normal regulation, normal variation related to meal. Okay. Is there any question here?
No, sir.
Okay, then we will move forward. Now, why this regulation is important? And this variation occurs because we are taking meal and we have to take the energy source. And with the intake of energy source, there will be normally increase in blood glucose level. That is predictable and expected. But the regulatory mechanisms try to regulate it within a certain range. That is the main concept here. Now, why this regulation is important? From physiological viewpoint, we will see mainly from the physiological viewpoint here for now. Both abnormally high and abnormally low blood levels are dangerous, as we have already seen. Dangers of low blood glucose level. The final clinical conditions we have mentioned, signs or symptoms, but the basis is impaired functioning of brain, retina, germinal epithelium of the gonads, because these organs or tissues rely mainly on glucose for their nutrition. You can say brain relies solely on glucose, means it cannot easily utilize other sources than glucose for its nutrition or energy. Therefore, low glucose levels are dangerous for brain. Therefore, you mentioned many of the symptoms of hypoglycemia, low blood glucose level, as confusion, nervousness, trembling, like this one. And in more severe cases, even seizures, unconsciousness, and even coma in very low levels can occur, even death. And similarly, these other tissues like retina, germinal epithelium of the gonads, also, for them also the major source is glucose. And when we say for these organs, the major source is glucose, what is the case about other organs? They utilize glucose when there is plenty of glucose, and they can shift to other resources, mainly fats, when glucose is not easily available. They switch between glucose and fats. And amino acids are given the last priority because they have to be saved for protein synthesis and to decrease the catabolic states. Okay. Then dangers of high glucose level. We have already mentioned, we will just list it. High extracellular fluid osmolarity. Normally, most of the osmolarity of the extracellular fluid is contributed by salts. sodium chloride mainly maximum is sodium chloride. You can just measure sodium chloride concentration in millimoles per liter, and then you can calculate osmolarity. And that is the case because normally blood glucose level concentration in osmoles per liter or millimoles per liter is very less. Around the concentration is around 6, 7, less than 7 in fasting state, for example. 7 millimoles. Sodium chloride is about 140 into 2 means 280 milliosmoles per liter. It is almost the whole osmolarity figure. Therefore, sodium chloride is the most important one in normal conditions, and glucose contributes less than 10. But in hyperglycemic states, when glucose levels are very high, they have major contribution, and therefore they can increase osmolarity, HCF osmolarity. When there is increase in extracellular fluid osmolarity, what will happen? The water will move from cells to the extracellular fluid. It means cellular deviation. We'll come back to again. For now, just try to correlate. Just remember there are dangers of hyperglycemia. Loss of glucose in urine, osmotic diuresis, increased risk of heart disease, stroke, renal failure, blindness, and mainly these are the long-term. When there is chronic hyperglycemia, persistent hyperglycemia, these complications are seen. Therefore, hyperglycemia has both immediate complications and also long-term complications. Now, what factors affect glucose metabolism? How glucose is handled in the body, and what factors will influence this one? And let's begin with the common sense. Carbohydrate intake, types and route. The amount of carbohydrate we take will finally determine the amount of carbohydrates, glucose. Glucose is most of the carbohydrate in the intestines. They are absorbed in the form of glucose. Therefore, we use glucose and carbohydrate metabolism equivalently here. When there is increase in carbohydrate intake, glucose level after meal will certainly increase. Therefore, the rise in blood glucose level after meal depends on glucose intake also. Types. Can you say anything about the types? What it means by type and route of carbohydrates? Here, I mean by type, I mean the forms of carbohydrate, like whether they are complex carbohydrates or simple, also called free sugars, like glucose or sucrose, monosaccharides or disaccharides. When they are taken, they will be more easily and more rapidly absorbed. Therefore, if there is hypoglycemia, to treat hypoglycemia immediately, we give these simple sugars. And what will be the meaning of route of administration of carbohydrates? Any idea?
The oral IV infusion.
Okay, good. What does it matter in glucose metabolism or any mechanisms related to glucose?
Yes, sir. Incretin effect is seen, sir.
Yes, good. It means finally, what will be the result? We will go into the details later. What will be the net effect if you take glucose orally and same amount intravenously? What will be the difference?
Sir, intravenously, that's a insulin less amount variation, sir.
Exactly, excellent.
Orally
Excellent. Okay, excellent. It means in most of the cases when we give intravenous administration, we expect the effects greater and faster. But in case of glucose, the reverse is true. It means same amount of glucose intake by oral route, when it enters the intestine or absorbed, insulin response or insulin secretion is greater for oral route than intravenous, because there is mediation of incretins. We will come back to it again. Good. Now, storage in the liver. We know glucose, most of the taken glucose, around 60% after meal, will be stored in the liver. Therefore, role of liver is very important in glucose metabolism. And next one is release, including new synthesis from the liver. When there is excess glucose in the blood, and we can expect its storage somewhere for later utilization. and liver can store when there is excess glucose in the blood, and it can release it when there is deficiency or low glucose levels in the blood. And it can even synthesize new glucose. We call it gluconeogenesis from amino acids. And this process is important to maintain blood glucose level, mainly for brain. Other tissues can utilize other resources like fatty acids, but for brain, it requires continuing supply of glucose. And role of liver here is very important. And uptake and utilization by skeletal muscles and other tissues. And it is also important, and mainly skeletal muscles. We can see skeletal muscles, they are one of the major utilizers of energy as a whole, not only glucose as a whole, because muscle contraction requires a large amount of energy, and therefore it will increase with exercise. We can expect it. And hormonal levels, and most important ones, insulin and glucagon, and also to some extent cortisol, growth hormone, adrenaline are also important to have effects on glucose level. And their hormonal levels and also their actions. By actions here I mean the sensitivity or resistance pattern. If there are adequate hormonal levels, but if there is resistance, that is again not going to have effect. And finally, renal loss. In most of the cases, or at least many of the cases, for example, calcium homeostasis, we saw the rate of renal reabsorption also regulates, as one important effect on plasma calcium level. But in case of glucose, normally, is there any renal loss? Renal loss in glucose. Normally, in normal healthy people, if we measure glucose level in urine, we cannot detect it. Therefore, the laboratory will report not detected. That is normal, and we will expect it. The body is designed in such a way that every mechanism, it has some significance, finally contributing to homeostasis. And one of the major way to maintain homeostasis is energy regulation. And loss of glucose in urine, that will be just waste of energy. Therefore, our body functions in a way that prevents any renal loss normally. But in diabetes or hyperglycemia, after certain levels, after renal threshold, after 180 mg per deciliter level of blood glucose, it will appear in urine. And after that, depending on the level of blood glucose, it will increase accordingly. And in one way, it is not desirable. Loss of glucose in urine is not desirable. But more recently, drugs that facilitate, that enhance renal loss are being tried upon to treat diabetes. And we can understand it. When there is more glucose loss in urine, plasma glucose level may decrease. But it is not a physiological mechanism. Renal regulation is not a physiological mechanism. The other ones, they are. And there are some conditions, special physiological or pathological conditions, or part of treatment that also can influence glucose metabolism, and that form the basis of explanation of the disorders and also the mechanisms of actions of different drugs. And they include, in physiology, you have to understand pregnancy, exercise, fasting, and also stress. Stress in physiology means any threat to homeostasis. For example, when there is exercise is also part of stress, physiologically stress. It requires more energy. If it is not regulated, there will be low glucose level in the blood, for example, and that will cause different disorders. And other stresses may be temperature abnormalities, very cold or very hot. Others may be certain illnesses. Any illness is also a stress because it is a threat to homeostasis. Therefore, in case of illnesses, blood glucose level may be high. The laboratory will report high blood glucose level, but we cannot conclude that it is diabetes, because diabetes means persistent rise. Therefore, in conditions of acute illness, when there is increase in blood glucose level, we should be careful to interpret it, and we have to repeat after the illness resolves. And pathological conditions, one important being diabetes mellitus itself, and others, drugs, various drugs used in diabetes. They also to some ways affect glucose metabolism, and mostly their mode of action will be one of these above points, from the first one to the renal loss. Okay, here is one summary of the mechanism of glucose regulation. Here we are not going into much detail, but it is one important overview, and all of us should know it. After a meal, increased blood glucose concentration is expected. Here increase is within normal limit. Here increase does not mean beyond the normal one. We are studying physiology here. In this slide, it is all physiology. Now, what happens? What is the response of the body to prevent excessive increase? If there is no regulatory mechanism, certainly it would go excess. But there are regulatory mechanisms, and that prevent excessive levels. And most important one here is increased insulin secretion. And this response is so designed that it acts very fast. Within 3 to 5 minutes of increased blood glucose level, insulin secretion will increase. And its effects are also very fast. And when there is decrease in blood glucose concentration, again insulin secretion is decreased within 3 to 5 minutes. And equally important, it is very potent effect. Means it can have profound effect on blood glucose level. Therefore, insulin secretion, it is the most important hormonal regulatory mechanism. And what is its effect? Increased uptake by muscles, adipose tissues, and other tissues. Almost all tissues in the body, they will increase glucose uptake under the influence of insulin. Here, brain is the exception. Its glucose utilization is not dependent on insulin. For rest of the tissues, it will increase glucose uptake and utilization. And here, muscles, liver, and adipose tissues, you have to remember this one. Liver, muscles, adipose tissues. And in the liver, the most important effect here is glycogenesis, glycogen synthesis, and prevention of glycogenolysis. Overall, there is increased glycogen stored. Excess glucose available is stored for later use. Simple. And then what happens after meals? Some hours after meal, there is tendency for decrease in blood glucose concentration, because the tissues are utilizing them. They are taking up glucose from blood. And certainly there is tendency for decrease in blood glucose. Then what happens? The opposite regulatory mechanisms, they are activated. Again, decrease in insulin secretion, that was increased after increase in glucose level after meal. Now it reverses. Its secretion comes back to basal level, and there is very minimal basal secretion. Even at the fasting stage, there is some insulin secretion, but it is very minimal. And the response when there is decreased blood glucose levels, tendency to decrease, and there is decreased insulin secretion. Now again, this effect is this insulin response, decrease in insulin secretion, and also its effects are very rapid. And here, blood glucose level will not decrease rapidly. I mean, like in the way like IV administration, it will be relatively slower, and insulin response will be accordingly regulated. And at the same time, there might be increased glucagon secretion, and this response of glucagon is physiologically important, especially in case of starvation, long fasting, and exercise. It means if we are taking meals normally, frequently, and we are not exercising too much, the most regulatory response is the insulin response, not the glucagon. But when we exercise or when there is fasting, glucagon response is also very important, and it is also a fast one. And mainly glucagon secretion increases after, it rapidly increases after fall of glucose level below 70 mg per deciliter. And when blood glucose level is above that, there is slight increase, but not so much. Therefore, the most important effect is again decrease in insulin secretion. And the final effect is glycogenolysis, means the stores of the glycogen that will again be released back to the blood. Gluconeogenesis, if that is not enough to maintain, it will be followed by gluconeogenesis, means synthesis of new glucose from non-carbohydrate sources like amino acids, some amino acids. And here this process occurs in the liver, therefore liver has one central role in regulation of blood glucose level. And blood glucose level will be maintained within above a certain level, that is prevents hypoglycemia. And finally next meal will come, and then the same cycle is repeated. Okay, is there any question here? It is very important, all of us should understand this one. And this is mainly related to the meal, and we know meal is the major cause of variation of blood glucose level in the body. Now again the same figure. Previously we just mentioned the levels, fasting level 90, and after meal or glucose tolerance curve, it is below 140, around 130. And now we relate it with the hormonal response here. At the fasting level, fasting state, insulin secretion will be less, and glucagon secretion is not still high in this fasting level if there is no hypoglycemia. And once there is intake of meal and increase in blood glucose level, there will be increase in blood glucose level, but it does not exceed, because there is increase in insulin secretion and increased uptake by all of the tissues, most importantly liver, muscles, and adipose tissues. And after some time, blood glucose level will fall due to it tends to fall due to utilization by the cells under the influence of insulin. And if it would go in the same way, blood glucose level would decrease below the normal level, but it is prevented by again decrease in insulin secretion. And if in case of exercise or fasting, glucagon also has major role here. Okay, then again next meal, and the same this graph will be repeated there. Now till now we mentioned about regulation of blood glucose level, and we also briefly mentioned the importance of glucose as an energy source also. Therefore, regulation of blood glucose level and use of different nutrients for energy, it denotes the two sides of the same coin. Blood glucose regulation and the pattern of nutrient utilization for energy is being carried out at the same time by the same mechanisms. We have already mentioned brain relies mainly on glucose irrespective of blood glucose levels. Even if there are low blood glucose levels, brain will mainly depend on glucose as far as it is available. And to some extent, it can use fatty acids, oxidation, the keto acids, but glucose is the most preferred one. Many other tissues and organs switch between glucose and lipids, as we have already mentioned. Again, amino acids, they are preserved as far as possible. And to some extent, the amino acids in the diet, they might be used, but the amino acids released from the previous stores, like in the muscles, they will always be preserved as far as possible. And what controls this switch between the utilization of carbohydrates versus lipids? And again, it is blood glucose level. And it is reasonable to have, it is it makes sense to have the role of blood glucose level as the switch controller. Simply, when there is excess availability of glucose, the mechanisms will be activated to increase glucose utilization. And when there are decrease in blood glucose levels, lipids will be utilized. Therefore, the switch also lies in the blood glucose level. And in many of the homeostatic mechanisms, the parameters that are regulated, they also are the stimulus for the regulation. They also influence the regulatory mechanism, and by that mechanism, negative feedback mechanism is possible. We have already seen it. Now, we will see the hormones that influence blood glucose level and its utilization for energy. There are some hormones that decrease blood glucose level, and there are some hormones that increase blood glucose level. There are multiple hormones that increase blood glucose level, but the hormone that decrease blood glucose level is mainly insulin. You can say only hormone. Insulin is the hormone decreasing blood glucose level, and hormones increasing blood glucose level. And as diabetes is hyperglycemic condition, they are also called diabetogenic hormones. They are loosely called diabetogenic hormones, and they include glucagon. We know that the hyperglycemic effect of glucagon, or in other words, blood glucose level increasing effect of glucagon, but it will not be increased when there is glucose level not too much low. It will be activated only when there is too much low glucose level. And cortisol is one of the other hormone from the adrenal cortex. We will study it later. Growth hormone, we have already studied it. And when we studied growth hormone, we mentioned its effect on glucose metabolism. And if you remember, its effect is to increase blood glucose level. Therefore, very high levels can themselves mimic the diabetic condition. And epinephrine, when there is sympathetic activation, there is again the tendency to increase blood glucose level. Epinephrine, maybe due to sympathetic activation or direct release from the adrenal medulla. Mostly from adrenal medulla, epinephrine. It is more important than norepinephrine to show effect in metabolism. Okay. Now, if you look at their relative importance, for day-to-day, meal-to-meal regulation mainly depends on insulin. And in case of fasting, exercise, glucagon also plays important role to prevent fall. And this cortisol and growth hormone, they are not part of the day-to-day regular regulation. But when there is increase in stress due to any cause, they also play a role. And their effects are slower, may take some hours or days. Therefore, for acute regulation, they do not have much effect. But epinephrine, sympathetic activity is fast to initiate, rapid neural mechanism. Therefore, it has a role in acute control also. And for exercise, it may be important. And there is one term called insulin-glucagon molar ratio. These are among the two major regulators of glucose level. Therefore, when there is abnormality in the blood glucose level, the ideal way to see the cause will be to measure both insulin level and glucagon level and see the ratio. Therefore, we can have the exact idea about what is the cause there, either change in insulin or glucagon or both. And their regulation is also interdependent. From the understanding of the physiology, we can have some idea. For example, at fasting condition, what will be the insulin-glucagon molar ratio? And if you compare this ratio after meal, what will be the difference? Which one will be higher? Insulin is the numerator here. Insulin by glucose. After fasting will be higher or after meal will be higher?
After meal.
After meal, because insulin secretion increases after meal. The numerator is increasing, means ratio will increase. At fasting condition, insulin secretion decreases. and glucagon secretion increases, it means the ratio will be less as compared to the condition after meal, postprandial condition. Okay, good. I have not written more about this. You can study from Canox. There are values also. Okay, now we will try to correlate the physiology of glucose homeostasis with the disorders of glucose homeostasis from the physiological viewpoint. From the exact pathology, you will discuss its causes and the chronic effects in pathology. For now, we will just try to understand the mechanism from the physiological viewpoint. Disorders of glucose homeostasis, broadly, we can classify them as hypoglycemia and hyperglycemia. It is easy to remember. Hypo is related to decreased blood glucose level, and hyper is related to increased blood glucose level. Hypoglycemia is also called glucopenia because penia related to decrease. And euglycemia is a condition with normal glucose level. Eu means normal. For example, euthyroidism in contrast with hypothyroidism and hyperthyroidism. Similarly, euglycemia also means normal glycemic control or level. Now, hypoglycemia, it is equivalent to the features that arise from low glucose levels, also called glycopenia, and signs or symptoms may arise with blood glucose level when it falls below 70 mg per deciliter. And one important thing here is it varies person to person also to some extent. And from other conditions also like stress, exercise, and others, the meal. Okay. And therefore, the symptoms are also important indicators of whether there is actual hypoglycemia or not. And interestingly, when there are mild symptoms, mild to moderate symptoms, and we administer glucose, for example, even orally or intravenously in more severe cases, many of the effects are reversed within minutes. A person, unconscious person even, or disoriented person due to hypoglycemia, when you give glucose, within a few minutes, he or she will be like normal. Very interesting. And the sign and symptoms, they may appear as nervousness, trembling, sweating. I think you mentioned all of them. And also palpitation, for example, tachycardia. And that might be due to the sympathetic activation with hypoglycemia. And in some people, that response may not be obvious, and that is called unawareness of hypoglycemia. That is not desirable. At least when there is hypoglycemia, if the people feel these symptoms, they are at least aware that I am going hypoglycemic. And others in more severe conditions, maybe confusion, even seizures. Hypoglycemia is one of the important and easily treatable cause of seizures. And loss of consciousness can occur when they are very low, in the range 20 to 50 mg per deciliter. And when there is more prolonged hypoglycemia, severe hypoglycemia, even death can occur. And one hypoglycemic shock or insulin shock, when there is excessive insulin, that can cause death. Now, hyperglycemia, and it is equivalent to condition or features arising from high blood glucose level. Normally, we have seen under fasting conditions, it is below 110 mg per deciliter, and 2 hours after glucose tolerance test, and after meals, and even with a large variation in the level of carbohydrate intake, the body mechanisms, physiological mechanisms, they do not let blood glucose level to go above 140. But in people who have already impaired regulatory mechanisms, high glucose intake or carbohydrate intake can affect this regulation, and therefore with increase in glucose intake, the glycemic control might not be as good as in normal case. And there is one classic triad, means 3 symptoms: polyuria, polydipsia, and polyphasia. Polyuria means excessive urination, polydipsia, excessive drinking or thirst, and polyphasia is excessive hunger or intake of food. Now we will see the mechanism Why is there polyuria, polydipsia, and polyphasia in hyperglycemia, for example, in diabetes mellitus? Can you tell something about the cause of polyuria?
Was filtered, so due to high glucose concentration. One is also due to osmosis, so increased urine volume.
Okay, good, good. That is the exact mechanism. When there is excessive blood glucose level, there will be excessive filtration because glucose is freely filtered by the glomeruli. Normally, all of the glucose is reabsorbed in the proximal tubules. But when there is very high glucose levels in the plasma, the filter load will also increase. It means if it crosses the reabsorptive ability of the nephrons, it will start to appear in the urine. With loss of glucose in the urine, the osmolarity of the tubular flow, tubular fluid will also increase. It means water reabsorption will be decreased because osmolarity is one of the important factors that impacts water reabsorption. Therefore, with increase in osmolarity of renal fluid, there will be impaired reabsorption of water. It means diuresis, increased water excretion. And therefore, there will be glucose also. Glucose is the cause of diuresis. And in the urine, glucose will also be detected. And according to the severity and the renal functions also, there will be increment accordingly. Mostly the levels, blood glucose levels, are the most important determinant. Then polydipsia, increased thirst. What will be the mechanism behind the increased thirst? Dipesh, can you hear me? Your microphone is off.
Yes, sir.
Okay, the question is, what is the mechanism behind polydipsia in hyperglycemia? Then one important note regarding polyuria or loss of glucose in urine. Remember one threshold value, that is 180 milligram per deciliter of blood glucose level. And after this one, the glucose will be detected or will be lost in urine. And therefore, when there is impaired glucose level that is crossing 180 mg per deciliter, it will be detected in urine. And the cutoff level of 200 makes sense there. 200 level is relatively arbitrary. There is no exact physiological significance of this cutoff. But at least it is in the level to detect loss in urine because 180 is the threshold. Okay, Dipesh, are you going to continue? Okay, we are short of time also. I will explain it. Okay, polydipsia, meaning, we know the meaning. Now it is caused by increased stimulation of the thirst center due to polyuria, volume depletion. Polyuria means there is excessive loss of water from the body, and there will be decrease in extracellular volume, and decrease in extracellular volume is one important stimulant of thirst center. And more importantly, it is increased extracellular fluid osmolarity with hyperglycemia, as we have already mentioned. And that will also stimulate the thirst center that contains the osmoreceptors. Therefore, there will be increased thirst. And with increased thirst, there will be increased water intake if water is available. But remember, if water is not available, or if the people are so sick that they cannot take water, there is chance of dehydration, severe dehydration. And it might be the cause of death, severe dehydration, because water regulation or the volume regulation is very important. Dehydration in hyperglycemia. Cellular dehydration, increased extracellular fluid osmolarity, movement of water from cells to the extracellular fluid. That is called cellular dehydration, because the dehydration is from inside the cells. The cells, their volume is less, therefore cellular dehydration. And extracellular dehydration means decrease in extracellular fluid water content, and it is due to osmotic diuresis, we have already mentioned. And after cellular dehydration, this one will also be there, and they are together, they are going side by side, and together there is loss of water from extracellular fluid and also in intracellular fluids. Polyphasia in hyperglycemia, and we have seen insulin when there is decreased insulin secretion or utilization. That is one major cause of hyperglycemia. What happens? It gives rise to catabolic reactions. Means glucose cannot be easily utilized. Means the other resources, fatty acids and proteins, need to be utilized, and therefore their stores are also mobilized, used, and that will lead to catabolic reaction. And the regulation of appetite or food intake, that mainly depends in the long run on the energy balance in the body. When there is catabolic reaction and there is negative energy balance, means the stores are depleting, they are being reduced. And at the same time, the short-term regulation of appetite is also carried out by blood glucose levels. When there are sufficient blood glucose levels, we do not feel hungry. In case of hyperglycemia, there are sufficient blood glucose levels, but that is not able to regulate the appetite, because it may be the possible mechanism may be the appetite centers, they cannot sense the glucose level in the extracellular fluid. Just like other cells like muscles, they cannot uptake glucose. And it may be insulin dependent, though other parts of the brain, they can function, and they function without mediation of insulin. This part is believed to depend on insulin to some extent, and therefore there is negative energy balance and also impaired regulation of appetite by blood glucose level, and it leads to polyphasia. And it is interesting to see that despite polyphasia, there is weight loss, because catabolic reactions are cause of both polyphasia and weight loss. Important one. When a patient has symptoms of polyphasia and weight loss both, a suspicion of diabetes is one strong likelihood. Okay. Any questions from your side? Next, we will discuss pancreatic hormones, mainly insulin and glucagon. We have discussed their overall function and regulation of glucose. Now we will see some more details about these hormones, their actions, not only on glucose level, but also on fatty acid and on lipids and protein metabolism. We already have some background for that, and we will go into some more detail in our next class. Any questions?
Sir.
Yes, please.
Sir, can I ask one question from the assignment of calcium homeostasis?
Yes, please.
Sir, sir, in thyroidectomy patient, what is the plasma calcium level?
Okay, the main thing that we have to understand here is, if after thyroid resection, if the parathyroid glands are not resected and they are normal, calcium regulation will not be affected. But the main problem in the case that was given is, the likely problem is decrease in there are symptoms of tetany, okay, sign of tetany, spasm, carbopetal spasm, as shown in the figure and also mentioned in the statement.
Sir, thyroidectomy. Sir, thyroidectomy means both thyroid gland only removed, or both thyroid and parathyroid gland both removed? Okay,
okay, good question. Thyroidectomy means removal of thyroid gland only. Okay, but from the anatomical relationship, we see that parathyroid glands are very closely related with the thyroid gland, and parathyroid glands, their size is relatively much smaller than thyroid glands. Therefore, if there is some mistake during operation, thyroid surgery, even with experienced hands, sometimes the blood vessels to the parathyroid gland, they might be cut up, or there might be some disturbance to parathyroid glands. In the worst situation, all of the parathyroid glands will be removed. That is the worst situation. But when there is there is when the surgery goes normally, calcium homeostasis will not be affected to significant level, because there will be parathyroid glands functioning. Even if there is one parathyroid gland remaining, after some time it will be able to compensate. But initially there might be hypocalcemia, because there is hypoparathyroidism. Your question here is mainly during thyroid surgery, are parathyroid glands removed? No, they are not removed. Any disturbance in their function is not desirable, but sometimes it can occur by mistake or even with some experienced hands, because they have to dissect through thyroid gland, and parathyroid gland, they are anatomically much more related to this one. Therefore, when there is disturbance of parathyroid function, maybe due to disturbance of the blood vessels or the glands themselves, there is chance of hypoglycemia. And as there are 4 parathyroid glands, if all of them are removed, the effects will be obviously there will be hypoglycemia. Even a single one is normal. There will be short-term hypocalcemia, hypoparathyroidism, but after some time, hypertrophy of the remaining parathyroid gland can compensate. From the background of the case, there is thyroid surgery and tetany. We know tetany is one of the important cause of tetany is hypocalcemia, and as there is thyroid surgery, the chance is that parathyroid glands might have been disturbed. Therefore, we say it is hypocalcemia following hypoparathyroidism. Is it clear now?
Okay, sir. Sir, or a question. Sir,
Yes.
sir, another question is, sir, loss bone mass density due to physical inactivity. So why it cannot be compensated by the calcium-rich diet?
Yes. The reason is that bone physiology. We did not talk much about bone physiology, but to compensate for that, I asked that question. And for normal bone health, there are some important factors that cannot be compensated by others. One is physical activity. Those people who are not physically active, for example, someone sick, bedridden, no physical activity.
So that means calcium. Any drugs that calcium tablets also will not affect.
Yes, the meaning is that not to the level of physical activity. It means if there is one person physically active, another person physically inactive, that it is one factor. Other factors are calcium intake also, and the hormonal regulation, including the steroids, estrogen. Okay, and these 2-3 factors, they all should be working together. If one is missing, other 2 cannot compensate for it. For bone remodeling in adults, physical activity is very important factor. Therefore, simple calcium, simple calcium supplementation will not make it up. It should be accompanied by physical activity also.
Okay,
it means, in other words, calcium treatment alone, in case of osteoporosis due to physical activity, calcium supplements alone will not be completely useful.
Okay, sir. Thank you.
Okay, thank you very much. Now we are already late, I think. If you have any questions, you can ask there in classroom also. Okay, now there will be next period, therefore I think we should stop here. Okay, thank you very much. Thank you, everyone. And after this class, I may not be able to prepare questions, because you have studied this topic in problem-based learning also. Most of the clinical correlation is already there. If you like, I will prepare. If not, I think that will compensate.
Sir, I have a question in comment section.
In comment section. Okay, good, Arun. I will see it. Thank you.
So it is here only, sir, in Google Meet.
Pardon?
It is here only in Google Meet, sir. I have texted.